there's other positively charged particles, like many of the environmental toxins that have penetrated into the cell can be taken out by glutathione. Yeah? And the way glutathione works is very simple. There's an enzyme called glutathione S transferase. S means sulfur. Yeah, it's that enzyme that puts the sulfur back into the glutathione. You know, when it takes out one of these positive particles, it uses up its sulfur. It gets oxidized, you know, and it's then useless. When it comes out of the cell, it's useless. It can't do anything anymore.
Okay.
And in order to be functional again, the glutathione then has to be given its sulfur back, its sulfhydryl group, and it's done with this glutathione S transferase. So outside the cell, it gets restored to its, it delivers the positive particle there, and in exchange it gets a sulfhydryl group back from this enzyme, and in that state it can go back into the cell. The cell invites it back in, and so it's one of these molecular pumps. Yeah, it takes out a positively charged particle. On the outside, it delivers that particle to the outside. It gets through the enzyme restored and goes back inside the cell and can back another one.
Now, is that what you call mobilization, if you were to just define?
Exactly, yeah.
Versus chelation, where people think it comes all the way out.
And this is sort of a beautiful place to make that point.
Okay.
We're mobilizing, let's say, a toxic mercury ion that had penetrated into the cell to the outside of the cell. It mobilizes it outside the cell. However, what most people in our field don't understand is that is where the job of the glutathione ends. It does not take it from there all the way out into your toilet. Yeah? It does not. It just delivers it from the inside of the cell to the outside of the cell. And then glutathione goes back in and leaves the metal there. If nothing happens with it, given enough time, the metal will then, because it its affinities and its properties, being a neurotoxin, will penetrate back inside the nerve cell and be there again. So with the glutathione alone, we would be on an endless loop of the metal moving out and then the metal kind of sneaking back in, moving out, moving back in. An energy consuming process, because every time the glutathione has to go back in, it costs energy. Every time the mercury goes back in, it uses the body's own energy to get itself in there. So it's an energy-consuming process with the net result of zero. That means if you only give a person glutathione and support that mechanism, you're sparing the body the energy to make new glutathione, and so it's a good thing, but you're not detoxing the patient with glutathione alone. It will take a second substance that then eliminates the mercury, or that mobilizes,
binds to it again.
It mobilizes the mercury from the connective tissue it's now, the extracellular space where it is now. It has to be moved from here to one of the, what's the Latin word? Emunctories. It has to be moved from here to one of the exit organs. And there's only a few of them. There is the liver, which excretes toxins via the bile into the gut. There's the kidney, which excretes toxins into the urine. There's the skin, which excretes toxins into the sweat. Yeah? There is the hair, which excretes toxins from the hair follicles, from the cells that make the hair follicle into the hair. And then there is the lung, which can excrete toxins into the air that it breathes out. Yeah? So there's 4 very well-known emunctories. And then there is additional processes that the body can use, like a tumor can grow, a myoma, a fibroid, and bioaccumulate a lot of toxins inside the fibroid, which has been proven, and use tumors as a way of an internal waste dump. Yeah? When all the other avenues have failed, the body can still create its own inner mechanisms in very creative ways. Or a bad tooth, which then is extracted, and in that, or an abscess, the pus being a way of excreting a product. So there's 5 mechanisms, by which the body can excrete things.
Okay.
And so we differentiate between substances that mobilize, like the glutathione, and then mobilize from intracellular to extracellular. Then we have substances that mobilize from extracellular into the body fluids or into the stool.
Okay.
And then we have binding agents. And that is very important. We know that neurotoxins are called neurotoxins because they have a high affinity for neurons, for nerves.
Right.
When you have a high load of mercury in the stool, let's say your liver has excreted via the bile a lot of mercury into the stool, then the mercury is nicely in the stool. However, as it travels down the gut, which is many feet from wherever it is, it's 12 feet, 16 feet still of traveling along the gut wall. The gut wall is lined with neurons. In fact, it has more neurons in it than the spinal cord. And the neurotoxins that are mobilized into the stool have a higher affinity to the nerves in the lining of the gut than they have an affinity to the stool material. The stool material is not nerves. You don't poop out nerves. Yeah? If you would, it would bind to that.
Right.
So it binds back to the membrane lining the gut, and the neurotoxins that the body puts so much energy into getting them to that point all get reabsorbed on the way down. And they then enter the system various different mechanisms through the mucous membranes, directly into the nerves, and travel back to the spinal cord, and from there to the brain, or through the enterohepatic circulation. Given good circumstances, the toxins are not taken up by the nerves, but just by the blood vessels, and they'll go straight back to the liver. And after the liver had spent months maybe of excreting this mercury into the gut, finally succeeding in doing that, within a few hours the same mercury is back there again, has to process all over again. Yeah.
So it sounds like you're talking about 3 different jobs: mobilizing, transport, and binding,
Yeah.
for lack of a
Yeah.
better.
Yeah. Yeah.
So,
That's called,
so
that's
what
called
people
the second
consider
one. Mhm.
chelation, what they consider chelation, is really a 3-person job:
Exactly.
mobilization, transport, and binding, and excretion.
So let's stay with that word transport.
Okay.
Yeah. So the transport from the connective tissue to the emunctories.
Okay.
Yeah? And then the binding to assure that it's safe on the way out. The same applies to the urine. Yeah. As the toxins travel through the kidney and appear in the urine, much of it is reabsorbed in the bladder wall. We know, for example, in Lyme disease, which is one of the infections that we need to talk about, that the body expends a huge amount of energy excreting the Lyme spirochetes and the neurotoxins in the urine. And then in the bladder wall, 90 to 100% of it is all reabsorbed into the bladder wall. That's why one of the key symptoms of Lyme disease is chronic cystitis, or interstitial cystitis, because the spirochetes and the toxins re-enter the system there because there is no binding agent in the urine. The physician that guided the patient has overlooked that simple fact. There needs to be a binding agent in the urine to assure that these neurotoxins are transported all the way out. And the same with the skin. It's a mistake when people think they can just sit in the sauna and they're outgassing all these toxins. What happens? Yes, the toxins appear on the surface of the skin. However, the neurotoxins and the lipid-soluble toxins, they have an affinity for fat lipids, not for air. And so it's a primitive thought thinking because the toxins appear on the skin that you've detoxed them. The moment you move from your sauna back to have a shower, they're all reabsorbed already by the time you get there. And so the way to make a sauna, the most the easy binding agent that you need to avoid the reabsorption is a rag. Yeah. So when people do sauna therapy with me, they have to take a stack of little washcloths in the sauna with them, and every few minutes, as soon as there's sweat on the skin, they have to you rub it off and put the rag outside the sauna, through the little window that you have, put it outside. And this is why often saunas in public places, regular saunas, are dangerous. Because you may be the one person that has already detoxed 90%, and you go in there to get rid of the dust 10%, but there's 3 other people in there that are just starting the process. So they're outgassing the 100%, which appears for a short while in the room before looking for lipid membranes to kind of attach themselves to. And of course there's osmotic laws. They go to the lipid membranes that has the least metals attached to them, which is you. So in a sauna, the traffic, well, in the sauna, the traffic of toxins is always from the most toxic person to the less toxic person. That's a law of osmosis. If they sit there long enough, the amount of toxins in both persons is the same. Yeah?
Okay.
It equalizes, goes from the higher to the lower,
Okay.
until the lower has as much as the higher. So this is the binding process.
Okay.
Yeah? So, but I don't want to lose ourselves. So let's kind of
Right.
recap where we are right now.
Okay.
Yeah. So we've established that as a fundamental underlying mechanism in autism, we're looking at toxins coming in, damaging the system, and damaging them to that degree only that the body is unable to use the molecular pumps to pump the toxins out before they cause damage.
Okay.
If they stay in the system long enough, they cause damage, which we'll look at later, where we look at the fundamental mechanism. And we're looking now at what are the molecular biological pumps that the body has available to excrete toxins from the cells, where they get stuck. How fast can the body do that? How effectively? And I just want to give now, to not get lost totally, I gave the example of one molecular pump mechanism as the glutathione
The sulfhydryl.
with the enzyme glutathione S transferase.
Okay.
And these enzymes are coded genetically. So all the enzymes in the body have a blueprint how to make them, and that's what we call the gene. Yeah?
Okay.
The genes are not what people think they are. They're simply a blueprint how to make enzymes. It's an instruction manual how to make these enzymes.
Okay.
And what we find in autistic kids, that they have a large number of what are called polymorphisms or absent genes. They're simply missing the instruction manual for making some of the enzymes that are needed for these biological molecular pumps.
Okay.
Yeah? And this is sort of one of the big pieces in the middle. Yeah? Why are they not excreting as fast as others? Yeah? It's the missing genes. And now let's look at the other molecular pumps that we have. I'm just going to give you a list now. One is called the apolipoprotein E. Apolipoprotein E comes in 3 forms: E2, E3, and E4. And again, it is a subfraction of cholesterol. However, it contains amino acids. And that's what's called lipoprotein. Lipo means it's really cholesterol, it's a fat, but protein means it also has amino acids.
Right.
And the lipoprotein, apolipoprotein E causes, is a wonderful mechanism that the body has, one of those pumps, that also uses cysteine, uses a sulfhydryl containing amino acid. It's similar to glutathione. It's the same mechanism. It can only bind substances that have an affinity to sulfur,
Okay.
which are the heavy metals that I mentioned, and a couple of xenobiotics. And apolipoprotein E, the type 2, per molecule, it can carry out 2 atoms of mercury.
Okay.
The apolipoprotein E3, which is another genetic subtype, can carry out only 1. And the apolipoprotein E4 can carry out none. And so here is a genetic variation that's very common, where one of the pumping mechanisms is completely absent, completely inefficient, non-working in many of the kids that we examine. And it's a very simple genetic test that can be done now, where we simply look at which subtype of the apolipoprotein E is there.